The 7 crossroads of fast weight loss. Physical hunger versus psychological hunger. So what is the difference between physical and psychological hunger? And what is the new science of craving? And then what to do with the comfort foods when you go on diet. Physical hunger builds slowly and occurs several hours after meal, whereas psychological hunger builds suddenly, unrelated to meal time. Physical hunger strikes the stomach, like the growling of the stomach or the hunger pains. Psychological hunger strikes above your neck, like the taste of food or smell of food or the sight of food. Physical hunger goes away and when you feel full, and eating leads to satisfaction. Psychological hunger persists despite fullness, and eating leads to guilt and shame. Now let's look at hunger versus food craving. Hunger is a general desire to eat and can be resolved by intake of any type of food, whereas food craving is an intense desire to consume a specific food. Hunger message is driven by ghrelin, and leptin puts a restraint on eating further. Hunger can be you feel hungry and loopy or hungry and alert. Craving, on the other hand, is derived by pleasure chemicals such as serotonin, dopamine, and opioids. Hungry and loopy versus hungry and alert. In our clinic, we determine it by looking at the carbohydrate intake and adjusting the carbohydrate and protein. There are 5 causes of food craving, like premenstrual food craving, stress-induced food craving, insomnia-induced food craving, deficiency of certain nutrient-induced food craving, and then allergy-induced food craving. Now, PMS-induced food craving is due to high levels of estrogen and progesterone 1 week prior to your menstruation, and it leads to craving for sugar and salty foods, and can cause weight gain of 1 to 2 pounds during that week. Imagine at the end of the month, if you gain 1 or 2 pounds, at the end of the year, you have gained up to 24 pounds. How do you combat PMS-induced food craving? We use a specific prescription drug called aldactone or spironolactone to balance your hormones. Why stress makes us crave for food? Because there is a specific messenger called HSD that activates the cortisol, and cortisol increases fat absorption and retention at the waistline, and increased salt retention leads to craving for salt, and increased insulin resistance leads to craving for sugar. When you have stress, cortisol increases, insulin increases, growth hormone increases, leptin, the restraint for eating, is also increases, and that leads to leptin resistance. And ghrelin increases, making you to eat more. So how to treat stress-related craving? To block the HSD messengers, you increase intake flavonoids that is present in apples, onions, grapefruit, and soybeans. You reduce cortisol secretion and restore your healthy metabolism by intake of flavonoids. We use adaptogens like Relora to promote healthy cortisol and DHEA production, and that binds to the GABA and serotonin transporters and encourages the feeling of satiety and relaxation, and normalizes your hyperfunctioning systems. Why insomnia causes craving? because ghrelin imbalance during insomnia leads to heightened sense of hunger, causing sugar craving, and a leptin imbalance impairs your restraint on eating. And elevated cortisol due to insomnia leads to craving for salt and sugar. How do you treat insomnia-related craving? You manage your sleep by good sleep hygiene. You synchronize your circadian rhythm. Sometimes we use light therapy, and we diagnose and treat sleep apnea, and sometimes you need sleep medication to control your insomnia and thereby control your insomnia-derived overeating. Now let's look at food craving due to deficiencies. Deficiency of particular nutrient like magnesium, chromium, zinc, potassium, or vitamins can cause food craving. Example, magnesium deficiency leads to craving for salty foods. Now let's look at carbohydrate craving. Consumption of very high glycemic index food such as donuts, cookies, ice cream, and yo-yo effect on blood sugar leads to carbohydrate craving. Hypoglycemia makes you crave even more sugary food, and a vicious cycle continues. We treat it with the L-glutamate, which blocks the craving. How do you treat food craving caused by deficiencies? You eat a variety of foods and take multivitamin supplements like magnesium, chromium, zinc, and potassium. Now let's look at why allergy causes food craving. Food allergy can cause a leaky gut syndrome, making you to absorb larger molecules of foods. And that larger molecules pass through the larger pores in your intestine. And that increased uptake of larger food particles cause inflammation and antibody production, commonly seen with the genetically modified foods such as GM modified potatoes. Food allergy causes a surge of endorphins, and that creates an addiction-like response to foods that cause the allergy, and causes craving for the food to which you have developed the allergy. How do you treat allergy-related food cravings? You treat the leaky gut syndrome by diagnosing your leaky gut by urine test, or treat with the probiotics to transform the intestinal microbacteria. And allergy food is diagnosed by skin and blood tests. Now, what about comfort foods? What are common comfort foods? There are 7 C's, like chocolate, cookies, crackers, candies, cake, ice cream, and colas, particularly the carbonated beverages that are sweetened even with the artificial sweeteners. In our medical clinic, we use specific approaches to block these cravings as well as balance your comfort food induced overeating. Furthermore, these details are given in our 10 road rules of slimming, which are 10 modules to learn how to balance your meals and how to combat the psychologically induced cravings as well as the balancing your comfort foods.